So Smiles for Recovery. All right. This is something I know is near and dear to your heart. All right. So talk to me about who Smiles for Recovery is for and the main mission behind this, because this is why we're here today.
Well, so in 2005, when I opened my private practice, I had come home from the military. So I'd been getting trained in the U.S. Air Force. I had a residency in the Air Force, which gave me a lot of surgical training. So when I came back, I was removing a lot of teeth, for patients that could not afford it. Like I would work for the jail. That's what I did when I was getting my practice up and going. I would see patients come through that had no money and they had toothaches, right? So what I learned over time is that these patients, they go through a very torturous process of removing one tooth at a time because all of their teeth are bad at the same time. See, the average person gets a toothache maybe every now and then, right? These patients, all of their teeth rot at the same time.
Wow.
So that means you got 32 teeth, right? So potentially you could have 32 single extractions because you have no money. And so it really hit home with me, and so I did that from 2005. I worked with some other nonprofits. I was helping patients that were coming out of prison, right? And they were going into halfway houses and they would have toothaches. So the mission for these people to help them get back into society was hard to do that because these patients would have to go to the emergency room whenever they had a toothache because that's the only relief that they could get. And so as you can imagine, it costs a tremendous amount of money to send all these patients through our healthcare system in the emergency room instead of dentistry, right? And so that's what happened. And then 2001, Justin Lowry, he was bringing doctors in that needed to learn how to place implants, right? So we were training young doctors on how to place single tooth immediate implants.
Okay.
And he would bring me patients, right, from his recovery. So he would go to recovery and he would notice that patients or people he was talking to, they would be hiding their smile during the recovery process that he was going through. So he would bring me these folks and then we would show the young doctors, how to place the implants on patients that needed this work, right? And so we started doing free work. I mean, I've been doing free work since I started on people that cannot afford it, or it's just it's a lot more fun to do work for people that can never afford it and who truly appreciate it, right? Like it just changes their personalities tremendously. And you get to see that because it's a process, right? Like you went through that process of provisionalizing your teeth, putting temporaries on, right? These patients go through a process of wearing temporaries also. And so once they get to the end, I get to know that patient through the process. I get to learn their personality. I get to see how confident this person becomes once they can actually smile and look into the mirror and confidently speak to someone without being ashamed of how they look. You know yourself, when you see someone on the street, right? They walk up to you and they smile and man, they're missing a tooth or they have a few black teeth, right?
Yeah.
You automatically put that person in a category in your mind as this person, man, something's wrong, right? Why would they walk around with no teeth, right? Or a black tooth in front of their head. And it's not because the person's not intelligent. It's because they literally have disassociated everyone in their family and they literally have nobody, right? And they have no money. They're trying to get enough money to eat today, right? Or to get that drug that they need, right? But they have no help, man. So when they have tremendous toothache, right, from dental pain, nobody's going to help them. And so that's what I see from the trenches, right?
Oh, wow,
I'm working and the average person just doesn't think about it like that. But that's what makes our mission so powerful, and when you do have a patient like that and you've taken out all their bad teeth, right, and you've given them implants and you've made them a beautiful new smile, that person actually, just like in church, that person goes back into the mission field and they actually try to help as many people as they can, right? That's what I've been seeing as I've done the nonprofit.
Wow.
And so, man, it's a powerful thing. And it's just, it's life-changing for me also because I get to meet so many cool people like you,
Wow. Yeah.
I didn't realize there was such a tremendous nonprofit community where so many people are trying to help others.
Wow.
And I just got organized, right? Like, because what I learned, Nick, was that I only have two hands, and I'm fast. I can do this stuff pretty well, you know, at this point in my career, but I can only touch so many people. So the more docs that I train to do what I do, the more patients I can touch theoretically, right, throughout the United States. So we're actually going to set this up. We have doctor partners set up right now in 5 different states, right? Doctors like me who are actually already doing this work, right? They're doing it already. They just don't have a voice, and they're not getting the word out. You know, they're just working in the trenches, man. And so we're bringing these doctors to light and actually helping them get organized so that they can help more people, and they can also train more doctors in their location,
right,
for a wider reach, man. And that's what it's all about.
I'm actually, while we're talking here, literally talking about what you just said. Justin posted a photo this past weekend. I think I can find it. There it is, right here. In 2 days, you guys put $1.2 million worth of smiles in folks that needed it. Is that right?
That's correct. So if I was charging what we normally would charge to do the work that we're doing for these patients, that's what it would be, right?
That's incredible, man.
It's we're not just doing dentures, right? Like, we're giving these patients fixed restorations that they can actually bite into an apple, right? So
I did.
Yeah, man. I told you, right?
Yep.
I said, go home tonight, eat an apple, right?
It was
You're
awesome.
good. But you don't realize, you know, only people that don't have teeth realize what an affliction it actually is.
That's right.
Like, you can't even fathom or imagine it if you have teeth. We don't realize what these patients go through, right? So there's a lot of psychology involved, and I recognize that when I see these patients, right? It's life-changing, man, for me.
Man.
So it drives me every day.
And it's unbelievable. And like, you know, honestly, Doc, when I first met you, I was impressed with what you were doing and all that other stuff. But then I can't wait we're going to talk about the business, actually, the businessman too, because as a guy that's built businesses before, like when I saw the tour, like literally, like you've got real wings of or like, you know, you've got, this is the general, like where the cleaning wing, the surgical wing, like and each wing has, you know, 3, 4, 5 rooms or more. Like it's like one floor of a hospital. You know what I mean? Like that's what it felt like. Well, it's huge. And it's just incredible, the machinery and the gear and the people and what you guys are doing in there. And just as a fellow businessman, I'm intrigued. It's impressive, dude. It really is.
Thank you very much.
Go ahead.
Well, I was going to say the reason it's like that in wings is because I would build 2,400 square feet at a time, right?
Yep.
So it's almost a 10,000 square foot building now, but I just didn't have the funds, you know, to do that. So I would get renters, right? And then I would build the next wing. But that's how I did it.
That's
incredible.
Started
from nothing, you know.
Wow.
So,
dude, that's incredible. I can't wait to get into that here in just a little bit. So let's go back to Smiles for Recovery and those folks that need, which, by the way, folks, if you want to check them out, I highly suggest you do smilesforrecovery.org online, also priorfamilydentistry.com, prior with a Y, priorfamilydentistry.com, and you can get 2 Smiles for Recovery from the main site, as well as on Instagram at Prior Family Dentistry, at Smiles for Recovery, and at, I believe it's Dr. Aaron Pryor's the other one. I'll double check that for the show notes. But folks, like I knew more than most, and I was in the dark. Okay, so what we're shining a light on, literally, we have people in our family that this is affected. I would say most households have somebody in their family that this is affected, right? So, and I want to get into some of the numbers, but you said a couple things that I wouldn't have thought of, which is when, so a couple things. The word hope comes to mind because when an addict comes out of recovery, or they're on day 1, day 2, day 3 of being addiction free, right? And if I'm using the wrong terms, correct me. There is
They're always going to be addicted.
Okay.
Right. It's just they're learning how to cope with their addictions and prevent themselves from placing it into their body.
Yeah.
Right.
And those new teeth give people something to kind of live for, to almost as a reminder or an accountability thing that like, oh man, I got some people invested in me, people believe in me. It's all those things on top of the fact that I didn't even think about it. If you're, what your teeth look like when they've rotted through a situation like that through extended use, I didn't even think about the pain and how that could cause them to relapse.
It's incredible pain. They can't get out of it. They can never get out of the cycle.
And those drugs are the only thing that can heal. Like, so not only are they in recovery, which there's pain there,
right?
Then all of a sudden you put, it would be the wrong kind of teeth pain is unbearable. And if you put that with like the I don't know what they're technically called, I call them the recovery shakes. Like
detox, they're withdrawals.
Withdrawals. That's it. That's the word I was looking for.
Right.
And literally two of our immediate family members have beat their addictions. Praise Jesus. But like, again, they had to get stuff done to their teeth. It's temporary. It's, they're actually going to be applying because we didn't even know, and basically it's a form of a denture. It's not like what you guys are putting in people's mouths are the best of the best. It's the best of the best.
It's what I'd give the best patients, and they could afford it out there, right? These people, we're giving them the opportunity to have what every American could have, So
what is some of let's get into some of the analytics for a minute. You guys know if you don't give them new teeth, how many people stay in, they don't relapse. How big of an improvement does something like this give on, like these are analytics from across the country, how big of an improvement does it make in recovery with something like this?
So since we've been keeping up with data over the last 3 years, what's happened is we've noticed it's almost 100% the patients stay in recovery, right? They don't go back and want to take the other drug because they're so blown away with the way they look now, right?
Yeah.
Just like yourself, right? Like you're looking in the mirror like, man, I can't believe how good this could make me look, right? And I waited so long to do it.
Yeah.
But these patients, they don't have a choice, right? So once they finally do look in the mirror and they see that they look normal again, right? What we would think would be normal, and we take it for granted, right? They go into the mission field, man. I'm telling you, like everyone, like you met Troy, right? Troy Sandifer. Troy's in the mission field, man, and there's no telling how many people he's actually helped.
Wow.
But if you asked him, how did that affect him, right? It got him, it gave him motivation, right? And he knew what was possible that other patients could actually have if they made it through the 12-month program, right?
Yeah.
So they have to get through the first 12 months of recovery.
Yep.
And they have to have a sponsor, right? So we're not just doing this for everybody, right?
Sure.
Now, I will get people out of pain. We call it the pain train. And so we have other doctors in the local area where if we have a person that's just now come into recovery, right? They're still addicts.
Yeah.
And they have a dental ache, right? A tooth pain. We can take that tooth out for them immediately.
Okay.
Like within a day, right? Like we will get them to some place to get them out of pain so they can quit focusing on that pain. And so that's another arm of our organization, right? But once they get through the 12 months of recovery and they have a sponsor, then that's when we can actually talk to them and start training them on how to take care of what we're about to do for them, right?
It's when you're doing the hardest things in life, it's hardest to do them alone. And every time these people look in the mirror, they feel the support of the people that did that. So I want to talk about that. How many people were in that picture of the $1.2 million of teeth y'all just put in 2 days, whatever it was? It was a couple dozen, it looked like.
Yeah, about 25 of us were there. It takes a big team, man. The doctors are just a small part of it.
Yeah.
I've got support people around me everywhere, and you have to have a tremendous team, and that's what we're in the process of doing right now is just adding great talent to our team so that we can spread the message.
So the goal of Smiles for Recovery is basically right here in good old Lebanon, Tennessee.
Yeah,
We are, you guys are building out the model that can be reproduced in all these other markets to do what you guys are doing under the Smiles for Recovery umbrella, to help out people literally nationwide.
Nationwide problem. We're going nationwide.
And all you but you know, one of the hardest things to do is scale to multiple locations, and because that's when you start losing consistency and the things that make it what it is, those little details that make it what it is. But by building out the model here, you guys are basically you're building out the playbook for all the other markets to go, right?
So all the doctor partners that we're accumulating, they come to Lebanon first, and they see how the process works, and then they make a decision on whether or not they want to partner with us. And so all the partners that we're already talking to and we have a relationship with, they're already teaching other doctors how to place implants and how to do the same thing we're doing. And so it's just a great partnership.
No doubt.
We find the right docs, right? We're not just picking any dentist out there. These are doctors that have large clinics that are already helping people. They're already doing free work. We're just giving them the platform that we have now, that we've spent the time, and the anguish going through setting everything up, right? The nonprofit, getting organized.
Yeah.
It takes a lot of time. You know that. So
It takes on average about a year just to get a 501c3 not-for-profit certificate.
I never realized that, right? I never even thought about it because I've always just given it away. It's so easy for me to remove a tooth, okay? Like I do it so many times a day that I don't even think about it, right? It's so easy to help someone to do that for me, right? And I never worried about getting paid for or having a nonprofit, but I realize, man, that I can reach more people if I get organized, right? So
yeah, that's right. And because people can track where their time and money and resources went to when you have that. And it's a way to also incentivize and reward the people for giving those businesses and stuff that they can do that and taking advantage of all the great government programs that we do have to help people out and so on and so forth. And that's why they're there, right? So we can do those things.